What's going on, ladies and gentlemen? It's your boy Brad back with another video. And what I wanted to do in this one is I kind of wanted to show you guys what my CVICU report sheet looks like. I have a little template here that I use every time. I print it off, I make copies anytime I start to run low. And this is just what I use every single day, day in and day out. I'll show you how I use it, how I utilize it to work well for me and meet my needs. So let's rock.
Are you listening? Nurse Pass. Beast mode. Grinding.
All right, so I'm gonna be holding my phone here as I do this, but this is pretty much what my report sheet looks like. From the top to the bottom. Very simple. We're gonna get into what it is. All right, what's the name of the patient? John Doe. What's the age? 67-year-old male. Code status, full code. This is just as we're going. This up here is where I normally put a room number, 2722, let's say. MD, this is just how I would go through a report. This is typically how we get report as well in the CVICU. John Doe, 67-year-old male, full code. This is the room number that we're in. This is a patient of CV surgery, doctor such and such. Who else is consulted? We've also got endo on board for post-op, glycemic control. We've also got cards on board, and we've also got EP on board because we're dealing with some post-op atrial fibrillation or something that we cannot control. All right, patient's past medical history. Let's say we've got hypertension, hyperlipidemia, coronary artery disease. Let's say we have an known EF of 40%. This is just like as we would be getting it. Chronic kidney disease, stage 3, and diabetes type 2. Hence why we got endo on board post-op. Anyway, allergies, no known allergies. All right, and then normally it's like, let's dive into the story. Well, what's the patient's story? Patient's presented on 2/12 ED with chest pain, times 2 days. They would say, I don't know what they were, ruled in as a STEMI, had a left heart cath performed, showed multi-vessel disease. What did we do? We lined them up for surgery, and on 2/14, 2 days later, they had a cabbage times 4, right leg harvest, where they may have harvested the vein to do the actual cabbage itself. And anyway, this is where we start writing out the whole story, okay? This is just all the details, the running list. This is typically how we do it in the ICU. We have 1 or 2 patients, and we just have a laundry list of details of the entire synopsis of the patient's stay. All right, so this is the entire patient story. Post-operatively now, we're post-op day 2 now, let's say. And what's the current situation with the patient, head to toe? All right, well, we start going through the neuro. They're alert and oriented times 2, afebrile, they're normal sinus. No, they're not normal sinus, they're an AFib, hence why we got EP on board. AFib in the 130s. BP has been labile, right? Let's say we've been systolics of 80s to, 90s. All right, we're struggling here. We have goals up here is where I like to put it, MAP greater than 65. And let's say we also have a systolic blood pressure goal greater than 100. Okay, so that's where we would hit that in report. Respiratory wise, actually, let's drop respiratory down here. We've also got 3 chest tubes, like 2 MTs, 1 PT, and then did -20 of suction, and here's what the total drainage was, for instance. Okay, respiratory, what do we got going on? If you hear the baby crying in the background, by the way, the wife is out there taking care of the baby. I'm not neglecting my child. We're just getting it in while we can in here, okay? A little bit of education. Respiratory, I don't know, man. They're on 3 liters per minute, okay? That's what they got going on. Lungs are diminished, blah, blah, blah. Okay, we would have talked about pulses up here as well. We would have talked about edema. Anyway, we go through the whole thingamajig. You get the point. Then, what else? We got diagnostics. What do they have going on, all right? Whenever they were talking about the respiratory system down here, we're on 3 liters with diminished lungs. We get chest x-rays on these post-operative hearts. Chest x-rays showed, I don't know, man, atelectasis, right? I don't know, a little bit of consolidation, whatever it showed, Okay, so we've gotten a lot of this data. Sorry, the phone died. So we got a lot of this data. This would have all been filled out as well, right? We filled out all the assessment, a little bit of pertinent, diagnostics is what DX is for. A little bit of diagnostics up here with a chest x-ray. All right, now we've got IVs, we could talk about a radial art line. We could talk about a SWAN. Patient has a CVC. couple peripherals, 2 PIVs, etc. Now we're gonna get down here to the labs. All right, patient, diabetic, endos following. What kind of AccuChecks? This is where I typically will put that. We have Q4 AccuChecks. All right, this is just what I'm saying, man. It's a nice, organized, easy way to keep things in line. Labs, we would list them all out. Okay, if I had trends, right, our hemoglobin, let's just say, for instance, our hemoglobin is 7.2, which is down from 9.1. This is how I would write it, just so I'm aware. Hey, man, we've had a big drop here. This is something we need to follow up on. Platelets, I don't know, let's say they're 112, which is actually up from 72. So now we're going to start giving subcutaneous heparin, whatever it is. Potassium, for instance, 3.4. What did we do? We repleted with 40 milliequivalents. If I were giving this in report, this is how I would be writing it. All right, so we're writing it on all of our labs. And then we're going to come over here, drips. What drips are we on? Normal saline is going at 20, our carrier fluid. We've been hypotensive, systolics 80s and 90s. I don't know, what are we on? We got Neo at 40. We're post-op day 2. I don't know, we're in AFib. We're probably on an amio drip at 0.5. What have you, PRNs over here. Now the patient's post-op, have they been in any pain? I really need to fix this. This little column is so darn skinny, but I just haven't fixed it in like over a year. But anyway, what have they been having? We've been getting oxy times 2 doses, 5 milligrams, for instance. So anyway, this is just how I write my report sheet, okay? This is how I can keep all my information. Boom, face sheet, easy to grab, look at what's been going on. Now, what do I do next? This is for the day. I've got all my information down. Now we're taking it, we're folding it just like so. What we got going on here? This was 27-22, we said, patient of John Doe. Now, this is literally, because ICU, let me turn this around real quick. ICU, every nursing job is ridiculous, right? If you were in med-surg and you're caring for 6 patients, your head is spinning at the end because you were trying to keep 6 patients straight in your head. My point is, ICU is wild. You do a lot of things rapidly, especially if you're working day shift. And, you know, implementing orders, a lot of things are changing with these patients rapidly in critical care. I have to write things down. I dang near write down everything that I do that is of importance during that day so that whenever I go to give a report, if you ever receive a report from me, you know I can be long-winded and sometimes too thorough. So when I go to give a report, I don't forget anything. So anyway, this is where I will be writing down. What did we do today? I don't know. What did heart failure do? They wanted to add on TID, 40 milligrams, Lasix. So that's what we did. What else did we do? We DC'd those chest tubes because the output was minimal, et cetera, et cetera, et cetera. The entire running list of all my updates from the day so that whenever I go to give a report, hey, how does it go? So it's just like this. Bang. Hit them all with all these information, everything that's been going on. If it's a new nurse, if it's not, what am I doing? I'm just hitting you with the updates, baby. And then I'm gonna come through here, right, with a little line right here, and what's happening? Next day I come in, updates from night shift. What happened? And then I'm drawing me another line, and now here's gonna be my updates from today. Of course, I'll probably use a different color pen, but nonetheless, these are my updates from the shift. When I come in the next day to take care of the patient, here were the updates from nights, and then here's my updates from my next day. So look, it's just all right here, easy, ready to go, running list. You're never losing it. You're never forgetting what happened with your patient. You're keeping it all straight in your head, baby.